Hey, Melissa.
Hey, Amy. So today we had Dr. Lisa Bowers, and she was phenomenal. She's a speech language pathologist turned doctor of communication sciences. She is an associate professor at the University of Arkansas, and her research focuses on language and literacy abilities of children from diverse populations, including children with hearing loss and dyslexia.
Oh, yeah. She had so much information. She's a member of several research teams focusing on best practices in interprofessional education and practice in educational settings. And she's also a director of the Service Learning Initiative. So she talked a lot about the interpersonal practices and just collaboration to understand the whole child. So it was really just not only eye-opening, but confirming as to what our needs and looking at the whole child to provide the best services for them.
Yes, I learned a lot from her.
I did too.
Really thrilled we had her on our show.
I am too. Okay, so let's take it away. And here's the podcast episode. Hi, this is Amy.
And Melissa. We are a couple of retired Texas teachers who are CALTs, Certified Academic Language Therapists. We started our own businesses, and now we have a podcast called The Dyslexia Duo.
So join us for our informative podcast, where we'll delve into dyslexia, covering the topics that affect parents, therapists, teachers, practitioners, and anyone who wants to learn more. We'll guide you through everything you need to know, from the first signs to the intricacies of dyslexia curriculum placement and beyond.
This season, we will cover the referral process, what to expect when your child or student is dyslexic, the generational impacts of dyslexia, and how to support those affected.
Come join us. For being here with us. This is Amy.
And Melissa.
And we're the Dyslexia Duo. So today we have with us a very special guest. We have Dr. Lisa Bowers, and she is going to introduce herself to our audience and explain a little bit about who she is, what she does, and everything about Dr. Bowers. So take it away.
Hi, thanks, guys. It's so nice to finally virtually meet you after a lot of back and forth. And just, I feel like I know you guys a little bit just from listening to your podcast. I've really enjoyed your previous guests, many who are really influential figures in the field of dyslexia and scholars I hold in high esteem. So I just really appreciate this opportunity. So a little bit about myself. I am a speech language pathologist by training. So I am an associate professor currently at the University of Arkansas. I teach undergraduate and graduate courses related to language and literacy in communication sciences and disorders. I also serve as director of Service Learning Initiative at the University of Arkansas. And in that role, I support faculty from all academic units on campus, students, and community partners. And we formalize and expand the service learning opportunities. So I'm a big believer in experiential learning and supporting our community through that learning process. And then I also serve as chair of the Interprofessional Education and Practice Committee. And that's through our national organization, the Council of Academic Programs in Communication Sciences and Disorders, which usually we just refer to as CAPSID. So that's been a really unique opportunity to learn from others from many programs throughout the country that are also committed to fostering growth and implementation of interprofessional activities. So advancing that collaboration in healthcare, which is where we usually see IPE and where I'm at in educational settings. So focusing on K-12 specifically in my area of interest and love, which is literacy. So thanks so much, guys, for having me here.
Wow, you're a busy lady.
It's all coordinated, right? We like these words, coordinated, collaborating.
No, it's great. It's perfect. So what led you to your current career, or maybe another career led you to this current place?
So after I graduated with my master's in communication sciences and disorders, I was a school-based SLP. So I always knew I wanted to work with kids. I love the schools. My mom is an educator. My stepmom's an educator. My sister works in the schools. And so I've just always loved that school setting. And my training, of course, prepared me for the school setting to treat speech and language disorders, working with IEPs, directly supporting students in that school setting. But early on, I really noticed this critical gap where many of the professionals in the school had kind of a limited understanding of who the speech language pathologist was and what our expertise and even what our role was. And I was really new. I was trying to figure out what that was as well. So I knew that I was well trained to be an individual interventionist, but I just didn't know how to leverage the skills and the knowledge that I had with speech sound development, receptive and expressive language skills, and literacy to be part of a team in a school setting. Yeah. And so that kind of gap in my knowledge and understanding led me to go back to get my PhD. And so my work there was really focused on language accessibility and literacy outcomes and working as a team with educators, specifically special education and deaf education at the time, and then later on elementary education. So a lot of my research has been focused on enhancing literacy outcomes and the overall health and well-being of individuals with oral and written language disorders, but through an interprofessional collaborative process with educators and other professionals in the school.
It sounds like a really brilliant collaboration.
Mm-hmm. That's what I was just thinking. It sounded really interesting too.
So the Interprofessional of Education Collaborative, IPEC, has 4 competencies that they've had for a long time that are really well established in medical fields, particularly with physicians and residencies, and even in our own work with occupational therapy and physical therapy. It's just not as utilized in educational settings. So a lot of those soft skills that are kind of implicit, we really haven't been explicitly trained or taught. How do we communicate effectively with teachers? How do we define our role and responsibility? And this is our expertise, but also, when we'll talk about this a little bit later, I think some flexibility in that so that we are coordinating those efforts instead of being so focused on staying in our lane. And so we're really working almost more in isolation than collaboratively. So I just think there's so many things we can be doing to coordinate and extend those efforts. And I just didn't have the knowledge or really skill set. I didn't feel like when I graduated to do that, even though I knew how to do my role, I did not know how to coordinate, extend my expertise to support both students and my colleagues in a really efficient and effective way.
Yeah, I think that kind of leads me to think about, on the flip side, for me personally, as a professional, I feel like I don't know very much about the different causes for speech delays and what would trigger somebody to even get the identification, even from an early age, and how that plays a role in literacy. And I know we're going to talk more about that later, but can you explain to me a little bit more about the causes for speech delays? Because I think there are probably other educators out there that might need to know that as well.
Well, yeah, I love that question. Particularly because your podcast focuses on literacy and reading difficulties, which are always typically associated with school-age children and adults. But there is growing evidence to support that early speech and language development is also closely linked to those later literacy outcomes. And I teach the early intervention course in our program of study. And so we really dive into some of those links and what that medical history and case history of early childhood development, it really does have an impact in what we're seeing later in the academic setting. So, from a speech pathologist perspective, we do cover the lifespan. So you'll find SLPs in the NICU working on feeding and swallowing, and also working with families with newborns and infants with genetic or congenital conditions, premature birth, so neurological conditions. So whether those are identified at birth or later on, like cerebral palsy or seizure disorders. So we're oftentimes in those medical, either inpatient or outpatient facilities, in those discussions with those more medically fragile infants and young children. Also hearing loss. So we work with kids who are deaf and hard of hearing. And then also come in, a little bit farther along, developmental delays that are showing up in speech and language, but also motor. So we coordinate efforts a lot of times with other professionals too, because it's not really clear with 18-month-old or a 2-year-old, is that a language delay or are they just a late talker? And there's that wide range of variability in early speech and language skills. A lot of times with autism spectrum disorders, SLPs will also be in those conversations as well. And those are happening birth to 5 before we get into the school setting. Oral motor challenges too. So we'll talk about articulation disorders, phonological processing disorders. So as kids are reaching those ages of 3, 4, and 5, they are becoming little adults with their communication abilities. And we think it's really fun. And you see the clips of kids that sound like an adult and look very young, but intelligibility. And when they are establishing those articulation milestones, a lot of times the SLP will be in those conversations as well. And more, we're getting a lot of referrals too for social factors. And so how we're working with collaborative practices in the preschool setting with our peers. Sometimes we're working with the behavioral specialist as well, trying to get some functional communication so that we can improve those behavioral outcomes. So we're really involved, SLPs, in that birth to 5. And again, a lot of those disorders or delays are going to have an impact in their progress when they reach that school setting as well.
I was thinking about Dr. Gabb's research of how she's talking about how dyslexia, they're thinking that you can even see changes in utero. And it makes me wonder too, if you could see some of those changes or the difficulties with the speech language development at the early age. Is that kind of like an integration difficulty that maybe that the brain just isn't integrating all the sounds, and is that maybe a cause for some of the reading difficulties later, or is it kind of the also factor? Do you have any input on that?
Yeah. So what I'm hearing is, asking this question, there's a couple of things. One, speech language pathologists look at structure and function, right? So we have a lot of training in neurological development, what areas of the brain are developing when, and how we're taking in sensory information and then integrating that with motor planning. So when you think about a newborn, right, their first job is to eat. But that takes a lot of motor planning. They have reflexes that are assisting with that, with, suck, swallow, breathe. But there's so much coordination that's going on between we have to breathe, but we have to eat. And so there's a lot of motor planning that's happening just immediately with a newborn. That also, when you think about sensory motor integration, is also happening. They're taking in information, and their brain is taking in all of that information and becoming very efficient and effective at, okay, this is background noise. I'm going to filter that out because I can't listen or process all of that information. Here are the speech sounds that I'm hearing in my world. And by 9 months, they're already in tune with, this is my native language or languages. I'm interested in these speech sounds. And I'm not interested in the sounds of any other languages that I could have understood, but now I no longer know or no longer feel a need to pay attention to those sounds because they're taking in all of those patterns. So there is this loop of the information that's coming in, how the brain is processing that information. And then with that sensory information, they're then expressing it. And so that motor planning piece, there's definitely a feedback loop that how you're processing what you hear and what you're taking in is then going into how you're planning to express those sounds as, it goes from babbling where they're just playing and a little bit more reflexive to then you get to some phonetically consistent forms. We're getting to our first word, and then we're able to establish that motor planning. So I've heard you say that word. It's very important to me as a 10, 11-month-old. I want that bottle. I want that water. I want that item. And now I know how to express that. And so I think, yes, we're seeing that all of this motor planning, it doesn't start with, while literacy is a learned skill because we created those arbitrary symbols that are written, and we're connecting that to our sounds that we've heard for so long, we have been planning those motor activities since birth. and really in utero as well. So I think that's where we are, like, how far can we move this needle back to see when we are establishing these patterns? And that's what our brain is designed to do, is take those patterns and make them very efficient and effective. And so for our kids with dyslexia, we know we can get those patterns. It's a different type of learning. I even don't like the deficit model, right? In the human condition, it's just, it has to occur in a different way because that's what their brain understands in order to be able to produce those desired outcomes of being able to read efficiently and effectively.
That's fascinating. Thank you for your outlook. I'm sorry, Amy.
No, it's okay. It's okay because you asked a good deep question and mine's just kind of more surfacey, thinking back to my experience. I had been in public ed for 30 years. So I went to Many and Ard in Texas for a while. It was Section 504, but Many and Ard, and very seldom, unless the child with dyslexia was also, had articulation issues, did I run into the speech teacher in the ARD. It was, we call them ARDs here. Maybe IEP meeting might make more sense to everybody else. Mm-hmm. But listening to you speak and hearing about all the different, from basically utero to current age, how everything relates, kind of leads me to our next question. How deeply is language and literacy tied together? Because I hear all this historical pieces that you're saying, and I'm like, why isn't the SLP always involved in those meetings with our students?
That's such a great question because I'm frequently advocating for the inclusion of speech language pathologists in literacy discussions. And so I think about this question of how language and literacy are tied. I just don't see any difference. Right. I think any sort of arbitrary distinction is just that, it's arbitrary. So I'm thinking about when my colleagues and I were writing our book. We wrote a book called Foundations of Language and Literacy, and it was very interprofessional. So I was there, elementary education. For every chapter, we have someone from a different perspective also contributing to the chapter. So English as second language, child development specialists. And we spent a lot of time when writing that book thinking about the cover. And one of my co-authors, Carmen Bell, she led the creative efforts. And we were just incredibly fortunate to have her really share her time and talents as we were really thinking about, like, what do we want the visual representation of this work that we talked about and then actually came to fruition in the textbook. So it was really important that the cover reflect that book's core message. And what we landed on was it features a sapling that's growing in a field by a lake. And so, just kind of starting out with your skills, but there's in the lake, there's a reflection of this fully grown tree. Mm-hmm. And so there's these deep roots and a very strong trunk, and then these branches with really luscious leaves all over them. And to us, that was really a powerful image that language is the foundation of literacy. You don't have literacy without language. So even if a child develops the decoding skills and they can be a fluent reader, and I think about one of my dear friends who's a specialist in reading in Korea, and she talks about, I could get you to decode Korean characters very easily because it's a one-to-one sound to character construction. She said, but you wouldn't have any clue what you were decoding. Yeah. But I could teach you how to do that really easily. And, a lot of people know that, but you can become a fluent reader and still struggle with comprehension. So I just think this distinction between, particularly with SLPs, we're the oral language and then literacy is over here. I think that's a really arbitrary and limited way to think about those skills because you just don't have literacy without that foundation in language. And you can be a proficient in many oral languages without being literate, but you really can't be literate without having a strong foundation in language.
Mm-hmm. No, I agree with that completely. And hearkening back to something you had said earlier today about how we should be working together more, but it's almost like we're in little silos sometimes and not crossing our paths together. And I can think back when I'd be surprised to find out, oh, my student is also seeing the SLP next door to me. And we would have these conversations, or she would come in my room and one of the curriculums we work with have the position of the mouth, what the mouth is doing when it says t-d, and one's voice and unvoiced. And she's like, You do that too? I'm like, yeah, we're always looking at our mouth to see what the mouth is doing when we start to read, when we start to spell, because it's important, because it's all linked together, And I was like, gosh, we should be collaborating more in our students.
Right.
I could not agree more. And I see that all the time, that it is indirect, as you're kind of saying, or you just kind of happen on that information, or proximity. Mm-hmm. I would love to see it. My goal is, by the time I find the end of whatever my journey or path is, that it's not this indirect or just kind of happenstance, but it's intentional.
Mm-hmm. Mm-hmm. I think that's a great goal. I would love to see that happen more often. A lot of times I would get a student that they were looking at for dyslexia. They've already been in speech for, a number of years. And I'm thinking, well, this should be labeled as kind of a red flag. I feel if they're having some speech delays, that's a red flag that maybe something else is going on with their phonological processing. And we could be on more alert for dyslexia that might be coming down the road. And then I think that's kind of where it leads me to my question. My next question is, why is articulation kind of always that flag for dyslexia? At least from my perspective as an educator, that's what I could see. I didn't know about all the other things that you guys address as SLPs. I would notice the articulation and be like, oh, I wonder if that kid has dyslexia. What is that's causing that?
Just another great question that is sometimes overlooked. And I agree. I think coming down the pike, this should be, if there is concerns on articulation, intelligibility, phonological processing, which are nuanced difference, but definitely different, that really should be one of the first things that we're looking at as a red flag. And when a child has consistent speech sound errors, right, that would be articulation, then you're seeing this motor planning problem that I was talking about earlier. Mm-hmm. So there's something where the first thing we look for is hearing loss. So we always screen for hearing and vision before we do anything else in speech therapy. And so is there a hearing loss? Because there could be a conductive hearing loss, or there could have been some trauma or some etiology that was unknown. So just because they've passed the newborn hearing screening, or passed the screening when they were 5 in kindergarten, we always screen for hearing loss. Because if they can't hear the sounds, it's going to be really hard to produce them efficiently, effectively, to the way that we would have that expectation. Mm-hmm. So when a child has consistent speech sound errors, that motor planning problem, there's a weakness in that motor planning problem, possibly, or it could just be inconsistent access to hearing those sounds, whether they have a lot of ear infections. So if we have a long history of otitis media and we've had tubes 2 or 3 times, that's the first red flag, because they did not have access to those speech sounds. And so, of course, they're going to have maybe an inconsistent, or what we would consider incorrect, production of that articulation sound. So when they're exhibiting articulation errors, that weakness somewhere in their ability to either hear the sound and or coordinate their muscles to effectively produce that sound, it makes sense that when you add in, again, these arbitrary written symbols, and so now they have this inconsistency in what they've heard and or how they interpreted that sound, and then how they're planning that motor planning part of how they're articulating that sound. Well, yeah, when you add in, here's the letter now we're going to match what you're hearing, what you're saying with this letter. It's just going to make that process for that student possibly more difficult. And it's not surprising to me that they would struggle with that task as well as it gets more difficult. Mm-hmm. Because really, language is acquired. We don't explicitly teach someone language. They pick it up in their environment. The brain's really effective at taking in those speech sound patterns, internalizing them, and then the motor planning and the motor processing piece. So if that's not occurring, it makes sense that now we're at a learn task with these symbols. That's going to be harder too.
We talk about a few times about how listening and speaking basically comes from immersion in your environment and listening to it. But reading and writing has to be explicitly taught, and that our brains haven't evolved to the point where we are naturally just exposed to reading and writing that we can pick it up. It made me think of that. I guess that's kind of where my stream of consciousness went with what you're saying. Our brains just haven't evolved to that point where we can pick up from listening and speaking and going into reading and writing. And then it made me think of some other things. So personally, as a child, I'm not dyslexic, but I had lots of ear infections and I was sent to a speech therapist. Okay. So this is back in the 70s, right? So it was some time ago. My last name would have just killed me as a child, honestly, with R's and THs in them. But because I remember I had a hard time with R's and W's and THs, right? So that's pretty normal. But I was going into fourth grade talking like that. So that was not normal. And I remember starting speech therapy and my teacher's name was Mrs. Abernathy. And I thought, oh my gosh. She goes, well, say my name. And I was like, Abernathy. And she goes, no. I was like, and I couldn't detect the difference between what she was saying and what I was saying, and I can see how that carries over into reading and spelling with that inability to detect, especially the subtleties of watching what my mouth is doing and hearing what I'm doing at the same time. It's weird that I went into this profession, honestly.
It's so true that, yes, and started to talk about, but didn't really finish that thought. But that's where we start first is, can they distinguish the sounds, right? Can they distinguish two different categorical sounds? And then can they distinguish allophones with a substitution or omission or distortion? Mm-hmm. Did you hear the same or different when I said work and walk? Was that same or different? Mm-hmm. And if they don't know, that's a problem. Mm-hmm. Like if we cannot hear these categorical differences and distinctions between phonemes or the allophones, and the allophones are, that with co-articulation, right? We never really have that pure speech sound necessarily. So you start with isolation and then you go to in coordinated speech or initial, medial, and final position, which is exactly what you as dyslexia therapists are going to be working with only in the reading context. If they can't do that orally, which is, as you said, our brains are wired to acquire language through immersion in our environment, how the heck are we going to expect them to be really proficient at doing that in a learned, much harder, more difficult task? And so then we would start with that auditory bombardment of just providing them access to that sound in those different environments. And then we get to, are they stimulable? And that's what your teacher was trying to see. Are you stimulable for it? If they're stimulable for it, but it's not showing up in their co-articulated conversational speech, I'm a lot less worried. If I can say this word, and they say it back to me, I'm like, okay, so we're stimulable. We can produce it. Now we just have to work with a lot of practice and drill in these different initial, medial, final positions, and then more phrases, and then co-articulated sentences and discourse so that it'll generalize. We need to get to that motor planning. You have this incorrect pattern. Now we need to correct that with the motor planning. We just need to retrain your brain to be able to produce it in this way.
So you're talking about more conversational, because if they can hear you say it, they can replicate it in a therapeutic setting. But when they go to conversational speech, they're lapsing back into, okay, I get, my oldest was in speech therapy too. And I remember because he did like initial S, he said it shh all the time. And I kept going, what are you doing, buddy? And so they dismissed him from fifth grade. And I was like, well, he still does that. And the speech therapist told me, he can show me in therapy that he can identify that sound. She goes, it's just a matter of time before it's important to him. I was like,
that's right.
Okay.
So they can have that skill. Sometimes they get a little, I'm from Delaware. You'd never know it from my accent now, but it's because I've been in the South for 20 years. But I go back to Delaware and my Northeast accent comes back. But if I'm around people, I went to school at LSU in Louisiana. My dad was transferred. So when I'm in Louisiana, it becomes, my accent's a different thing. And so I can work on it, and I can accent modification for myself in different environments. But my husband's the same way. When he goes back to Tennessee, there is a Tennessee drawl that is there that it's almost as we cross the border from Arkansas to Tennessee, it starts showing up. So it's similar to that, right? That if they can hear it, distinguish it, say it, and say it in different contexts for us in the therapy setting, it's really up to them to generalize it. And I think sometimes it is how important it is in your peer group.
We'll be right back after a word from our sponsors.
Hi, this is Melissa with Kids First Dyslexia Services. I am excited to share with you my private practice. Kids First Dyslexia Services is a private practice that specializes in dyslexia therapy. Each one-on-one session focuses on instruction specific to your child's needs in a nurturing environment that develops self-esteem, builds confidence, and fosters a sense of accomplishment, resulting in happier kids with higher levels of achievement. We provide a professional, personalized experience, always putting the child first. We value the relationships with both our students and parents because strengthening skills and overcoming hurdles to achieve desired goals and success is a team effort. For more information, please visit www.kidsfirstdyslexia.com. That is www.kidsfirstdyslexia.com.
Hi, this is Amy Rodenroth, and as part of the Dyslexia Duo podcast team and owner of Discovery Dyslexia Services, I want to talk to you about my business. Our COUT-trained team offers expert virtual or in-person therapy located in Prosper, Texas, using proven dyslexia curricula like Take Flight, Build, MTA, Alphabetic Phonics, and Reading by Design. We also provide crucial independent evaluations and advocacy services. Don't wait. Empower your child today. Visit www.discovered.com to learn more. That again is www.discovered.com. Discovered, covering all your dyslexia needs. Let's return to the show.
So do you think that the repetition through speech therapy would be advantageous to kind of be closer to mastery before they start getting introduced to this in, let's say, language therapy through somebody like a CALT? Or do you think it's best to do it at the same time?
That is a great question. And what I would say is I would want that to be coordinated efforts. I would not advise that we have to have mastery in speech therapy before we would start with reading. I think we'll talk a little bit about the spell to read approach too. It's kind of the same thing, right? You don't look for mastery in reading before you learn to spell because spelling influences reading. And so
Right.
I think it's the same. What I would say is the same. And so what speech language pathologists, we have a lot of training. We definitely have an area of expertise, but it's not magic. I'm not the only person who can work on S in the initial position that you were talking about, right? So with just a little bit of training, and again, making sure it's coordinated and intentional, the speech therapist, can provide you, the CALTs, here's what we're doing, and here's what I'd love for you to support in your therapy setting. And then vice versa. Tell me what you're working on, because I can support that in what we're doing as well. And so that cross collaboration is just going to coordinate and extend versus, hey, I'm going to finish what I'm doing over here and then you can start. But it can get tricky if there are some differences. And that's where you really do have to collaborate and get on the same page and say, well, I'm seeing this a little bit differently. And you do have to come to a consensus. Otherwise, it's going to be confusing to the student. If I was thinking about what Amy was saying when the speech therapist came in and said, we work on this as well. Well, if I'm using one program and I'm using some set of how I'm talking about the articulators, what I've named the muscles of the mouth, right? So if we're thinking about teeth or the tongue and our lips, like there are programs out there that have these really cute and very functional ways of talking about these sounds. Well, if I'm using that set of language and some other therapist that the same child is seeing is using some other different ways of describing the same motor planning processes that we're trying to get to, that's confusing.
Yeah.
And if you've got a language deficit or disorder that's in the mix, then it's really confusing for them. So again, we are distinct. We don't have the same areas of expertise and we wouldn't want to, because then what SLPs bring to the table wouldn't be as rich and expansive. And what CALTs bring is so important and valuable. SLPs some are duly certified and I know them and they're amazing, but they're few and far between. We can't have every SLP also being a CALT, because then who's working on all those other disorders that we work on, right? So we have to coordinate and extend. You're thinking about the kid.
I love that. I totally agree with you. And so then I guess what I would ask you next is, how can speech therapy and dyslexia therapy, how can they work together to benefit the child's improvement in both speech production and reading acquisition? I know you touched on that a little bit. So I would just ask a little bit further. Do speech therapists use a multisensory approach to instruction, kind of like what we do in our dyslexia therapy?
Yeah, I love this question. I think it is nuanced. So in our field, we have standards. So when you enter into a master's program for speech language pathology, we have what we call the big 9 areas. So receptive and expressive language and literacy are one of those. Cognitive communication, fluency, and by fluency, we're talking about people who stutter, not necessarily oral reading fluency. And we are the lifespan. So we're birth to end of life. But a lot of our strategies, I mean, we came from B.F. Skinner, so we're behaviorists at the core of our field. So we are looking to modify behavior to improve communication outcomes. And that's oftentimes going to be multisensory. Now, I use the multisensory teaching of basic language skills that I know has been talked about on this program. So my students have access to that. And I know a lot of different programs, they have literacy in their curriculum, but they may or may not have a designated course like we do at the University of Arkansas. I think there was a study that showed about 35% of graduate programs have a designated course on language and literacy, and they may or may not be using the same materials I am. So I know that's what my students are being exposed to. I don't think that all of our textbooks should be written by SLPs for our field, right? I just think that that book might be a little too much for the SLP who's not going in the school, but it's going to become their core reference that I wish I had had going into a school-based setting. So yes, I think that a lot of the components of a multisensory approach to instruction, particularly when working with language and literacy, are being taught and have that training, but it's not as intense. I have gone through the academic training for CALT, and so it's a lot of the same principles. It's just not as intense. But a lot of the principles that they're teaching in different programming for sure are embedded within the course curriculum for SLPs. So I would say, I think the second part of your question was that collaboration piece. Is that right? Like how to collaborate. So I think, again, just being intentional, and that's what I would advocate for, is that the strategies that the SLP is using, again, like I said, they're not magic, they're not proprietary. Oftentimes, SLPs are sending home homework to parents. So where they're at, they're inviting, and I would hope supporting parents to also be part of that process as you're working on that motor planning. We can't do it in 30 minutes. Yeah. That's not going to happen. But I think, again, if what we're doing is not being supported or is even in kind of contrasting what's going on when they're receiving services from the dyslexia interventionist, who, quite frankly, if it's being done right, the dosage that they're getting, right, the time that they're getting from a dyslexia interventionist, and certainly from their gen ed teacher, is far more than anything that we are going to be able to provide and support. So I think the most powerful part of an SLP's work sometimes in the school setting is that consultative model. Here's what you should be doing, and here's what you can do. And this is something that is a strategy you can work on initial S. I remember one teacher a long time ago when I was, kind of fumbling through this as a young SLP, she said, "But I teach math." And I said, "That means that you are smarter than me and also can help this fourth grader with his initial S to not be interdentalized," right? That's a very fancy way of saying, tell him or just remind him or give him the model when he says an interdentalized S, when he says think and he means sink. I didn't understand that. Did you mean sink? You can do that. That's not hard. And you're a math teacher, so I know you're smart. And that is not a strategy. But again, there was this but that's not me. I'm this bucket. And I think, Amy, you said, I'm in this silo. I'm the math teacher. And we just have to broaden that. I am not a math teacher, but you know what I am? I'm a language expert. And so give me those math word problems at the bottom of that worksheet that they do not want to do because they can do that math, that student, but they don't understand the language of the math word problems. And I can do those word problems and help them support through that process of understanding those the language in the math word problems, even though I'm not a math teacher. And I think we just have to continue broadening that perspective.
I agree. And I think that kind of lets me think about my students as well, that I had mentioned in our questions about a student that has difficulty with vocalic R. And I'm working with her privately after school 1 day a week. And I'm teaching her our combination ER sounds. And I'm so worried that I'm going to mess up what the speech teacher is doing to teach her vocalic R. And I'm like, but it's and I'm trying to show her, okay, look at your lips, they're puffing out, and then your mouth opens a little bit, then it closes, so I'm explaining it all to her. And I'm like, oh my gosh, I'm so nervous about what the speech teacher is going to think about what I'm doing. Is this right? How should I work with somebody like that if they are seeing a speech therapist? Like, what could I do that would be beneficial for my students?
Oh, I love hearing you ask that. And it also kind of hurts me a little that you're carrying this worry of what if I'm messing it up? Because my response would be, I'd ask them, right? I would ask the question or just say, could you add me to the email that you send to the parents so I can see the worksheet? Because I know you are a highly experienced, highly trained professional, and having that first instinct of, I don't want to mess this up is a wonderful one. And then if somebody asked you, hey, I don't want to mess up what you're doing as the dyslexia therapist, can you help me? I know just from our interaction today, your first response would be like, absolutely, yes, this is what you can do. And I'm so glad you asked that question. And so I think I would anticipate you have the same response from the SLP of, yeah, here's what I'm telling the parents to do. Or here, I'll send you. I mean, it's so easy, right? With technology, here's a video of the strategy that I'm using. I'll text that to you.
Yeah, that's wonderful.
And so that's such an easy way, again, to just coordinate. Or if you don't want to do the strategy, you just can I show the student the video of you when it makes sense in what we're doing? Because I want to make sure they have that appropriate. And then you just show the video of the speech therapist. You don't have to be in the same room. You don't need an extra course on this. And I will just say too, vocalic R is the trickiest of all speech sounds, in my opinion, to master, because when you think about what we talked about with motor planning, you can't see it. It's only in co-articulation, right? So you can't even do it in isolation. And you hear it. And when you hear it, we as native listeners know it, but it's the most imprecise. And that's why there's so many R's. And that's why a lot of times they become muddled, just this, right? Because it's so hard. You can't do it in isolation. You can only do this in co-articulation, and you can't see it. There's absolutely nothing to see. Then I will share with you, and we can share this, that there are some great resources too for feedback. When you think about auditory bombardment, there's a lot of apps now that the student you can say your R and you can watch it. Here's where you want to be in the mouth, and it'll show, front to back, top to bottom, kind of this space. Here's where I am. And then they can say, look, well, here's where you are. You're neutralized right in the center. Can you get it to work? And they watch it. And that visual, again, multisensory, that watching what they're saying, they're visually seeing that they can move the needle to get from look to work. It's fascinating. Some of them, that's all that they need. They need that visual representation of what they are saying. And then all of a sudden that connects to, oh, and here's that R rounded. I mean, we think our symbols are arbitrary. I love that. It's so fascinating. And Dr. Shaywich's book goes into that, about our symbols are actually not as arbitrary as we think they are, right? That they visually sometimes look like the sound that we are expressing too.
Yeah, that is fascinating.
That's wow. Okay. Goodness.
So I hope you reach out to that speech therapist.
Yes, I will. Thank you for that.
That's just such an easy, again, connection. And to make you feel peace of mind and confident in what I'm doing is coordinating, not conflicting with this other professional that they're seeing.
And I think that's the fear that we all have, because as CALTs, as dyslexia therapists, a lot of us are, we're trained in Orton Gillingham methodologies, but a lot of us in Texas are using dyslexia curricula. And we've been told, if you've got a student that you're seeing after hours, you need to provide the same curricula to avoid conflict or confusion with that student. And I think that's the fear that we all kind of walk with is, oh my gosh, I don't want to mess this child up any further with what I'm doing, and I think that's the concern that we all have. But going back to good fit educators, you had talked about, of course, CALTs and SLPs, they work together well, or dyslexia teachers and SLPs work together well. You even talked a little bit about the math teacher can do a little work with the word problems. What would be some ideas of some really good fit teachers, educators who could work with the SLPs?
I love that question. I'm going to back that up to give a little bit of context to what I talked about, some terms, interprofessional education and interprofessional practice that I hope become a little bit more normalized in the educational setting. So interprofessional practice is when professionals are coordinating efforts, they're learning with and from one another, and they're practicing using these skills of effective collaboration, teaming, teamwork, roles and responsibilities. I know my role, but I also know your role, and I know where we have shared understanding and again, how we can grow and extend from one another. And then values and ethics. I value you. And I think that kind of touches a little bit on what I have experienced and thought, where I should know more and I don't. And so that's what keeps me here. Like I need to keep this persona of I am a professional and I know what I'm doing. And I think that's sometimes why we don't share. We have this what if I'm doing it wrong? What if I learned I've been doing it wrong? And I think we just have to, all of us collectively have some empathy and some understanding that we're all doing it kind of wrong. Because if we weren't, we hit the ceiling of we're doing it to the best of the ability and we'll never be able to grow. That's just not reasonable. So I've just had to allow myself the freedom to say, I'm actually not doing it right. I'm doing it to the best of my ability with the knowledge and skills that I have. And so is everybody else. And with interprofessional practice, when you work on that explicitly, you build that empathy and you build that space for vulnerability, which is where you get the coordination and extension. If you are not coming to that space vulnerable and humble and with this value of I know what I bring to the table. I'm very confident in that. And also, I don't bring everything.
Right.
But this person brings a lot. And that goes from experience to novice. I don't really feel comfortable. I've now been in the field longer than I really want to say, but more than 20 years. And so I consider myself on the experience side. I want a novice at the table. I want someone brand new because they bring something that's really very different to the table. You just don't want everyone. You don't want a table where everyone has 25 plus years experience necessarily. So that's what interprofessional practice is. Backing that up, interprofessional education is when that's happening when you're the pre-professional. And so to your question of who would be a good fit, here at the University of Arkansas, we're really lucky because of higher education is a whole little ecosystem on its own. And our field is everywhere. I was trained in the College of Arts and Science. I got my PhD at the Health Science Center. Here, we're in the College of Education and Health Professions. And so it's really a magical fit for speech language pathologists. And within that structural fit, I work really closely with counselor education, special education, elementary education. We also have occupational therapy within my own department. So we're really lucky to have that here. And we have an administration that really supports that. And so my goal is to continue, with our textbook that was interprofessional with our contributing authors. If we aren't at the pre-service level teaching these future professionals to value each other and that we're learning with and from each other here, it just seems so if we're saying you need to value collaboration and you're looking into a sea of pre-service speech language pathologists and I'm the instructor, that's not really modeling collaboration.
Yeah.
And so we're really making an effort to have these undergraduate courses. And some of this is because of our state guidelines for the science of reading. They have the same standards in special education and elementary education. So we're working to create opportunities to learn together so that when they get to their school and they are the second grade teacher, they've already had courses with special ed and speech path. So they know those professionals, they know those roles and responsibilities, and they'll feel more comfortable and confident creating those spaces of let's learn with and from one another. Those are really some of the key players. We also work with social work. They're so vital and important, again, for thinking about holistic child outcomes. But those are the ones that I have seen the value in really targeting specifically is special ed, elementary ed, and speech language pathology. There's too much overlap and connection, particularly with language and literacy, for us not to be coordinating our efforts as the instructors of record for our pre-service professionals so they go with that foundation of, I'm going to seek out these people because I know they're there, versus we tell them they're there, but we don't really model how do you do that.
I'm thinking back to when I was pursuing my bachelor's back in the Wayback Machine. And it was just a bunch of elementary ed teachers with a reading endorsement that kind of went from class to class for the last couple of years. You know, I didn't interact. Shoot, howdy. I'm telling you right now, I didn't even know what an SLP was until I got to a campus. You know, I didn't know that they had them in school systems because I went to private school. So they had to bring in somebody for me to get my speech language, my articulation piece worked through. So I think that could be a vital, important piece that they start to bring into those pre-service teachers.
Yeah, because think about, just in your experience you shared, how long did it take you to think about, okay, now I need to know who she is. Now I feel a little vulnerable because I didn't know that the speech therapist would be in this setting. Ooh, why didn't I know that? Is that something about me? Okay, so what exactly do I do? Can I ask them, or does that show that I don't know what they do?
Right.
And so you've already set up this barrier that really isn't even there. It just, you weren't trained and you weren't provided those learning opportunities. And so the other part that we're trying to do here is coordinate those preceptors. So, I talked about service learning, and that's one of the pieces of service learning is I want to make those interprofessional. Everybody's doing internships. All of those professions are in counselors. They are in the schools for one of their rotations. Maybe they won't be a school-based counselor, but some of them are going to be. Same with speech therapists. So all of our speech therapy students in graduate school are going to internships and clinical practicums, as we call them, in a school setting. Where are the pre-service teachers? They're there too. Where are the special educators? Guess what? They're there too. And so we're really trying hard and had some success with coordinating some of those experiences. Sometimes we did an after-school programming. They weren't meeting together physically because of time constraints, but they were asynchronously communicating online and talking about their experiences because they had the same child, just at different days. And just that limited exposure and understanding was so powerful, the feedback from those students. So I just feel really strongly that if we are not modeling for our students who are being trained to be the professionals in the schools, and one of the reasons they're leaving the educational setting, not the only reason, but one is feeling of belonging. So if you don't feel that because you have these barriers, how do you find your people? Well, maybe that shouldn't be a soft skill. Maybe that should be something that we are training. Here are your people.
No, I agree with that completely. I can remember as a dyslexia therapist, I was on an island. I felt like I was by myself on a campus, and I shouldn't. I mean, I had friends, but they weren't doing what I was doing. And it looked very, very different.
Well, and I think even that collaboration piece leads to better identifications as well, because you're learning from each other. You know exactly what all the students, well, not all the students, but a lot of the students that are struggling, you will know, this is what this looks like when it's dyslexia, or this is what a speech delay might look like. So all of that collaboration together as a team would really be improved if you had those types of relationships.
Absolutely. I mean, I just could not agree more.
This completes part 1 of our interview with Lisa Bowers. Join us next week as we conclude our discussion. The Dyslexia Duo podcast hosts are Amy Rodenroth,
Melissa Dean.
Our producer is Greg Rodenroth.
You can find us on Facebook at The Dyslexia Duo.
Email us any questions or comments at thedyslexiaduo@gmail.com.
Awareness is so important. Share this podcast with your friends,
Family,
and teachers.
thanks for joining us.
Bye.